If you have a significant family history of heart disease or stroke, I think you should see a primary care doctor for starters, but maybe also a cardiologist, because you may be at especially elevated risk, and then you need more advanced screening compared to the general population. Typically, screenings start at age 40, but some patients may need to be screened a little bit earlier. Certainly, if you have symptoms of heart disease or stroke, like chest pain and other symptoms of stroke that can cause numbness in the extremities or weakness, those require immediate medical attention. And then, if you're someone who has not the healthiest lifestyle, if you're overweight or obese, is also a reason to see your cardiologist early on, because you want to get ahead of the curve and control your risk factors so that you can prevent future heart disease or stroke. My name is Dr. Mahmoud Al Rifai. I'm a cardiologist at Houston Methodist. Commonly, what your primary care doctor or cardiologist will order blood tests, checking your cholesterol, checking your glucose control with A1C, checking other hormones like your thyroid function, just to make sure that there's no secondary causes of high cholesterol. These are basic screening tools to check for risk factors. And then we have more advanced imaging tools. Coronary calcium score is one of the most important ones. It is not a screening tool for heart disease, it's more of a risk arbiter, meaning that if the patient or the clinician is uncertain about someone's future risk, a coronary calcium score can favor statin or no statin depending on how high your calcium score is. Patients who are younger, who may not have a calcified plaque in the arteries of the heart, sometimes may benefit from carotid ultrasound to check for plaque buildup there. And then if you have any kind of chest pain or concern for plaque buildup in the arteries of the heart, then getting a coronary CT angiography, which is a CAT scan of the heart with contrast to be able to look at the arteries of the heart, look for plaque buildup, look for blockages, and that kind of thing can be useful. Other patients may benefit from a stress test. So that's where you inject a radio tracer in the heart, and then you acquire images at rest and stress and look for basically impaired blood supply to the heart muscle, or in other words, perfusion abnormalities. Those are some advanced screening tools that we can look for heart disease or stroke. The stress portion of the exam, as the name entails, is we need to exert some kind of stress to get the heart rate up. So there's multiple ways you can do it. You can either do it with exercise. We commonly will get up patients on a treadmill or a bike, and then we can inject them with that radio tracer. Or another way to do it is with a chemical. The end result is the same as getting your heart rate up so that we can inject that radio tracer. Now we have a multitude of smartwatches and Fitbit, and there's actually now studies that have enrolled patients who are wearing those wearable devices. What we get from these smartwatches and Fitbits, they give you the average heart rate, the number of steps, the heart rate variability. These are all kind of correlated with your cardiovascular fitness. There's no concrete data that we can use those numbers to actually gauge someone's risk. There's a published study recently on using this metric where they divide someone's average heart rate by their average number of steps. Actually, it was shown to correlate with future risk of heart failure and heart disease and stroke, but they still have not yet been validated, so they're not mainstream in clinical practice. But I think if you have that data, sharing it with your physician and clinician, I think may kind of help gauge someone's risk, but we don't use them routinely as of yet. I think the future is promising with the data that you can collect from those smartwatches and how you can use it to gauge someone's risk of having future heart disease. I think it was an interesting study showing that a simple number just from your average heart rate and number of steps can actually predict future risk of heart disease and stroke. But before we incorporate it routinely, I think it needs to be validated in other populations. But it definitely is it opens the door for future research in the field. Regardless, I think it's important that you be active. I think those smartwatches I think are good kind of feedback to say like how many steps have I taken today and what is my goal? Have I met my goal? I think for some patients it actually is a motivating factor to getting more active and getting more fit. So I think that's also where the power of those smartwatches lies.